Good afternoon, everyone. Thanks for joining. We will get started shortly. Welcome again, everyone. We're just going to give other attendees a few more seconds, maybe another minute to jump on before we start today's webinar. So just sit tight and we will begin soon. Okay, let's get started. My name is Anna. Thank you for joining the National Safe and Healthy Housing Coalition as we hear from members of the Lead Safe Cleveland Coalition on our webinar today entitled How the Lead Safe Cleveland Coalition Scored Major Policy Wins in 6 Months. Before I hand it over to the presenters though, I just want to go over a couple logistics. First, today's presentation is being recorded. The recording and slide deck will be made available online to you at NSHHC's website at www.nchh.org within about a week of today's presentation. And you'll also receive a follow-up email with a link to the recording and some more information on how to access those slides after the end of the presentation. So those will be coming later. Also, just to minimize the unwanted feedback and background noise, all of the attendees are on a mute and listen only mode, but that doesn't mean we don't want to hear from you. We encourage you to ask questions at any time during the presentation. You can do this by entering into the question box. It should be on the right-hand side of your screen in that control panel there, and we will get to the questions at a Q&A portion at the end of the webinar. Also, we have a hard stop around 3, but if we don't get to your questions, we can certainly get those to the presenters and get those out to you. So we will do our best to get all of those answered in a timely fashion. So with all those logistics out of the way, I'd like to give you just a little bit of background information. The National Safe and Healthy Housing Coalition is a 600+ member national coalition, which works to provide our members with information exchange and opportunities for advocacy on the healthy housing issues. We're hosting this webinar as a part of our ongoing effort to spotlight state and local efforts in hopes that our members can learn from this and other examples of great work being done across the country. Today, we've invited Dan Cohn from the Mount Sinai Foundation and Ken Foreman from the Environmental Health Watch to share the story of a recent policy victory in Cleveland. In addition to learning about the city's new policy to address lead hazards in homes, we're looking forward to hearing about the coalition and partnership building, the policy development, and the advocacy that went into the adoption of this new policy. So with all that said, I will turn it over to our first panelist, and Dan, you can take it away.
Thanks so much, and a huge thanks to the National Safe and Healthy Housing Coalition for hosting us, for reaching out. We're so excited to share with you and with our colleagues across the country about the incredible work happening here in Cleveland. I should say before we hop in that we are sharing with you a very small sliver of a huge, big, hairy, audacious beast of an issue, not just around lead poisoning prevention, but also around healthy housing. There are multiple players and multiple stakeholders that we will do our very best to hit on today, but certainly by no intention we will inevitably leave important players out, and we apologize for that, but we are doing our best to get through this in 45 minutes, so we appreciate your grace. Just a little bit of background on the presentation. We'll share, as Anna mentioned, some background on the Lead Safe Cleveland Coalition, on the lead poisoning challenges in Cleveland, as well as how the coalition sort of came together to some to some extent in the mechanics of the coalition and the ways in which that's contributed to the recent passage of a lead ordinance, what's been called a historic legislation. So we'll jump right in here. And without further ado, I should probably introduce myself. Let's see if I can advance the slide here. As Anna mentioned, my name is Dan Cohn, and I serve as Vice President for the Mount Sinai Foundation here in Cleveland, Ohio. I've been with the foundation now for about 4.5 years, and I oversee grant-making strategy across all 4 of our grant-making areas. 2 of those include community health and health policy, and while most of our policy work has historically happened at the state level, this issue of lead poisoning and the solutions and the solvability of this particular problem inspired us to really get involved with local policy for the first time. And we're just excited to share in the success of our incredible community effort and to assist in a very small way in helping continue to move the ship forward. And with that, I'll hand it over to my incredible colleague, Kim.
Thank you, Dan. Hello, everyone, and thank you for joining the call. I'm happy to be a part of this webinar, and I've been working on healthy homes issues for over 21 years now. Environmental Health Watch has been around and in the healthy home space of the movement for 35 years, and I've been a director at EHW for the last 5 years, and so we are focused on healthy homes and sustainable communities, but we also have been a unique and vital resource to Greater Cleveland and a go-to organization because our framing is environmental justice and health equity. And over the years, I've developed the approaches that we take and really grounded our work, even our research work, in a direct service components, so that we can understand what families are facing and how to mitigate hazards in moderate and low level interventions. And also that approach also helps us understand the advocacy approaches and how we might lead or influence the policymakers and decision makers. We work with many organizations over the years, and this is really about the fact that we've taken the time to learn aspects of the research and development and approaches on the ground through all of the many partnerships and projects we've been a part of over the years. And I've been a part of many of these. But what's important about this is unique as a nonprofit is doing the research, but also having some direct service components to that research. Next slide. So before I started, Stu Greenberg, who some of you on the call might know, Stu Greenberg was really part of the development of Environmental Health Watch, and there was a group of concerned citizens who cared about dumping and the right to know. And to date, we still have a lot of the programmatic aspects through the solid waste district as it relates to the work that was done. And so we got our funding to get started from Gunn Foundation, who we still have a relationship with today. And now we're known in 1985 as Environmental Health Watch. So it's been an important part of our work to make sure that we have this environmental justice component and really understand and work with all institutions, residents, and really work with landlords on compliance assistance and understanding the barriers related to what residents and tenants face on the ground. The Greater Cleveland Lead Advisory Council is a great part of this partnership, multi-sector partnerships working together. And one of our biggest wins was the adoption of looking at 5 micrograms per deciliter as an action level across the county. And the Greater Cleveland Lead Advisory Council did include county and city directors of health departments. And so we also, as part of this work, working with National Centers for Healthy Homes, Alliance for Healthy Homes, looked at the lead ordinance. So part of the national project work, we really worked on the lead ordinance for our city and advocating for that. And now we're here at this place. There's a lot of stuff that happened in between that I just won't get into, but it's been an awesome ride in evolution of the work from program research, development, coalition building, and multi-sector partnerships. So I'll talk a little bit about the issue in Cleveland and, you know, just working across the country, understanding this is a national problem and crisis. This reflects some data from 2016 at the census tract level, and we have these high areas or hot spots, right, that we know we have the right approaches, we have the right folks to work on the ground to really dig into these areas and eliminate lead poisoning. We have this opportunity with the coalition.
Can I insert something here?
Sure.
What's important to note, in addition to the extraordinarily high levels of lead poisoning that we have here in the city of Cleveland, you'll see on the screen 25% of children are test positive for an elevated blood level at or above the CDC reference level by the time they enter kindergarten. What's also important to know is that only about 21.5% of children are appropriately screened and tested at ages 1 and 2. So that 25% number is astronomically high, but it actually only represents a very small fraction of children who are being tested appropriately. And although we don't want to make data out of anecdote, it is important to understand that the 80% of children that are not likely receiving appropriate healthcare services are probably also those children that are most at risk for other environmental hazards. So 25% among the children that are tested appropriately, but there's another 80% that are also likely at risk or perhaps even at higher risk. So this issue is extremely pervasive in the city of Cleveland, as it is in many Rust Belt cities and other municipalities across the country. I'll just briefly hit on this. One thing that's an important note to undergird a lot of this work is that, again, this is the same map that you saw before, and it goes without saying that this is not dissimilar. In fact, this is almost an identical map to historic red line map. So this is an actual red line map of Cuyahoga County, the city of Cleveland, and you'll see, I don't know if your computers can keep up with the toggling back and forth, but you can see that the hotspots of lead poisoning are not dissimilar from historic disinvestment, and that's a really important piece of this ongoing conversation.
And just to add around the redlining in the conversation around race, values, decision-making, policies, and how it impacts us today, not only with lead, but with a lot of the different social determinants of health. If you haven't heard that term, look it up. But every issue that's facing people, low income, people of color, people in these areas and communities is very similar. You can map it out. So we must think of other ways and creative ways and more equitable ways, thinking about solutions, but being a lot more holistic in our approaches and these new approaches and new systems we're trying to create. So we know that this is a public health crisis with a housing solution. And I've been at every meeting and at every table, really trying to get folks to really think about the housing as the root cause. Now we have more language to talk about root causes and social determinants of health. Housing is a root cause of this issue. Poverty is one of those other issues related to housing that we see the impacts with something like lead poisoning as a symptom of a larger issue.
And one of the important pieces about this in particular, and as Kim had mentioned, you know, housing deterioration is not just the single issue. It's connected to a whole host of other issues related to, of course, the social determinants of health, though we know that that term has been beaten to death and sufficiently diluted. But it's important to know that understanding that this is a solvable issue, that this is one that we can really wrap our arms around, and one for which there are clear answers. This is a really deep problem, and it's symbolic of a whole host of other problems, but it's a venue, it's an opportunity for us to create systems, create policies that in some ways address the other underlying issues, but do so through a way that is manageable and around which we can build a container. And that really leads us then to the launch of the Lead Safe Cleveland Coalition. And as Kim had mentioned, there have been innumerable partners that have been involved with lead poisoning prevention efforts over the years, dozens, if not more, and a long history of incredible work that's happened in the community, both at the grassroots level. We have incredible grassroots engagement here, a very active media. The Cleveland Plain Dealer has done incredible work reporting on environmental toxics, particularly lead poisoning, and a whole host of other related issues that are deeply connected with unsafe housing and, frankly, outcomes for moms and babies and communities writ large. Lead Safe Cleveland Coalition builds on those as an inclusive public-private partnership launched in January of 2019 with a commitment to making Cleveland lead safe in 10 years. We started off with a group of about 50. We have now expanded to a group of more than 400. And this is not just a listserv, a passive listserv. This is a group of 400 plus folks that are working actively across 7 working committees. Many of them have subcommittees, and these are regularly meeting either on a monthly, sometimes a bi-weekly basis. And folks who are not coming to the table necessarily because they're following where the money is going, or in the ways that sometimes, you know, social change or these types of things can go, but in fact, it's a bit of an informal constellation of partners that are coming to the table because we view this as deeply connected to all of our individual missions. If you care about education, you must care about lead poisoning prevention. If you care about maternal and infant health outcomes, you must care about lead poisoning prevention. If you care about criminal justice, community development, economic development, housing stability, all of these issues bear directly on lead poisoning prevention, and that's why this group has grown so large, is because each person sees their individual missions reflected in this really important work. I'll keep zipping through this. As I mentioned, the focus of the coalition, as Kim had mentioned, is a primary prevention focus, proactively making homes lead safe before they put children and families at risk. And we looked across the country, actually for many months. The coalition was in process since 2017. And it was announced in January 2019, but only after we had done a good deal of research, especially with our partners over in Rochester, but there are many models across the country from which we borrowed best practices, promising practices. Certainly our colleagues in Greensboro, North Carolina, our colleagues in Cincinnati, Kansas City, Omaha, Nebraska, Washington, D.C., you name it, we probably talked to them. Many of you on the call, we also probably talked to you, and we are grateful to you for bestowing upon us your wisdom. But the basic notion that we began from was lead poisoning is an issue that we know a lot about, and we know the answer. It's not a question of can we do it, and it's actually a question of will we do it. Can we cultivate the political will in order to get policy and systems change over the finish line to protect children? Ultimately, that led to our public commitment of a comprehensive prevent and long-term approach that focuses on smart and equitable policies, knowledgeable agencies willing to collaborate and not just say they're collaborating, but actually collaborating, which sometimes means angry phone calls on Christmas, which one of our council colleagues will remember engaging with me with last year. But it really operates at that level of change happening at the speed of trust, as Dr. Dietz says. This could not happen were it not for a long history of trust building over a 2-year period, really. That leads into, of course, proven community leadership and programs, as well as public and private sector accountability. This is a public and private partnership. It's not publicly owned and it's not privately owned. It's owned by everyone, and everyone really feels accountable, I would say, to making sure that we live out the values.
So what was very important, and I've worked with a lot of multi-sector and work with a lot of partners, but we can't jump in a room and then start crafting solutions without understanding, are we speaking the same language? Are we on the same page? We want to find that out early on. So what we did was we took a look at the Rhode Island principles, Ohio Healthy Homes Network, and HMED's principles, which are environmental justice principles that were put together, and thought about what's important for Cleveland and how can we set a tone of collaboration and authentic relationship building and engagement. And we really have done that, and everyone at the table has taken on these principles, activated them in real spaces, and thinking about real systems change work, right, which is moving beyond program to what are we really doing and who are we doing it with, meaning that we must appreciate and respect the impacted citizens and the impacted parents. So this has been part of how we work, what we do, and our approaches, and it's very important to set this type of stage when you're building a broad coalition like this.
And I'll just share, Kim really shepherded this process. It went through our governance committee, and I'll share the structure of the coalition in just a moment. But this was a process of iteratively going back to these terms, and it wasn't a pseudo-intellectual conversation, which sometimes these can be a deep, dark black hole, and making sure that we're extremely precise about the language we're using in a way that causes everyone to roll their eyes. But in fact, this was a living and breathing process, and our guiding principles continue to be a living and breathing set of principles that come up regularly in our full coalition meetings, and this is something that was presented over and over, and we had real dialogue about what these mean and how we live into them. And that led to the creation of this current structure. This is the Let's Save Cleveland Coalition. It's overseen in a sort of advisory capacity by a steering committee, which includes chairs of each of the committees that I'll talk about in just a moment, as well as, and this is really important, at least 30%. So 30% plus one of people on the steering committee are those directly impacted by lead. So we're talking about families, parents in particular, grandparents, or if we're directly impacted also included those who are providing services, so perhaps a pediatrician and or a teacher or someone who's directly working with children who have been lead poisoned. The steering committee also includes civic leaders, members of the coalition at large, and 2 representatives from the city of Council, rather the city of Cleveland, one from the city of Cleveland Council and one from the city of Cleveland administration. The steering committee is represents then all of the committees that you see there. So we've got the policy committee chaired by Enterprise Community Partners, the resource development committee chaired by the George Gunn Foundation, the community engagement committee chaired by our friend here, Kim Foreman at Environmental Health Watch, the Let's Save Home Fund, or excuse me, the Let's Save Home Summit committee chaired by the United Way, research and evaluation chaired by our colleagues at Case Western Reserve, a workforce development committee, which is in a state of becoming, and we'll share a little bit more about that. And then, of course, the governance committee chaired by my organization, the Mount Sinai Foundation. I'll share with you here our action plan that we announced in January, and then we'll walk through a little bit of the mechanics of each of these committees so that you can get a sense of the type of work that they were doing leading up to policy change. In January, so January 22nd of this year, we announced the formation of this coalition as well as the establishment of the action plan. The action plan included establishing a community goal, making Cleveland lead safe in 10 years, check. Introducing legislation, we not only introduced but got it passed, check. Holding a lead safe summit, which I'll describe for you in just a moment. Creating a lead safe home fund that we'll dive into great detail in just a moment, and advocating for state and federal support. And I realize we don't have a slide on state and federal support, but I'll be sure to include some verbiage on that. Here are just some quotes from that initial press conference that you can review on your own time. I don't want to waste too much of your time reading through those, but it's really important. I think what's important to note is that you're seeing people from multiple sectors, nonprofit, elected officials, philanthropy, all coming together, recognizing that we are stronger when we're standing shoulder to shoulder, and that this is something that we all have to take on. So when we're looking at that structure, that first committee that you saw on the list was the policy committee, facilitated by Enterprise Community Partners. It's a national organization. They're a housing intermediary, and they often play, at least in the Cleveland context, play a backbone role for really effective cross-sector coalitions that take on robust, challenging community-wide issues. Their work resulted in the Lead Safe Cleveland policy, which is outlined here. I'll run through it just in a moment, or I'll run through it now, and then I'll share with you a little bit about the coalition's process. The policy, which was passed in July of 2019, requires proactive third-party private rental inspection of all rental units in the city of Cleveland built before 1978. So this is not relying on city inspectors, but rather third-party inspectors that a landlord or a homeowner would go out and find themselves. And it requires then that each of those properties be made lead safe and certified as lead safe on a renewed 2-year basis. And that lead safe certification is based on a clearance examination. We're happy to talk a little bit more about that if there are questions on it. A couple of the really important and innovative pieces of the policy are the evaluation pieces and protections against unintended consequences. The law actually requires a public reporting on a quarterly basis on potentially unintended consequences, which include things like displacement, vacancy, homelessness, any of those things that we are worried, of course, in a low-value housing market in Cleveland might inadvertently, unintentionally be caused when we put additional requirements on landlords. The last thing, of course, that we want to do is require tenants to choose between a safe and healthy house and having a house at all. We don't want to drive homelessness as a result of this really important work, but we also know that if we don't start somewhere, then it's never going to get done. So this is a process of publicly reporting, and there are sort of backstops in the law that say, look, if these issues are present, there's a public reporting process, and we can go back to the drawing board if this really isn't working for our community. That's really important. There are a couple other pieces to the policy that are also important around oversight and enforcement. The legislation calls for a lead-safe advisory board. That advisory board includes at least 7 people that span sectors, including a landlord, representatives from the Lead Safe Cleveland Coalition, representatives from realtors, and others. I think community organizers was another group. And that group is responsible for ongoing monitoring of the policy, its implementation, and its consequences. It calls for a lead screening and testing commission because, as I mentioned previously, our lead screening and testing rates are abysmal. And by the way, that's not unique to Cleveland. That's Ohio-wide, and frankly, as we talk to our colleagues across the country, lead screening and testing rates are abysmally low elsewhere, but in Cleveland, they are particularly bad. So it calls on healthcare providers in the city of Cleveland, including our partners in federally qualified health centers, as well as our large hospital systems, to come to the table and come up with an action plan for how we get those lead testing and screening rates up. The legislation also calls for a lead safe auditor, a sort of third-party external auditor of the system and the process. It also calls for the creation of a lead safe ombudsperson, someone who can monitor and provide direct intervention if the system, for whatever reason, is not working. And what's also not included here is a lead safe housing action team. One of the issues, as I mentioned, is the potential for displacement. So that action team basically requires that all housing organizations doing business in the city of Cleveland come together and devise a plan for how they will respond if displacement is caused by this policy. And frankly, if people have to temporarily move as a result of interim controls, the application of interim controls or other home repairs, we expect that in the vast majority of cases, people will not be displaced by interim controls. That's pretty rare, if ever. But the fact of the matter is that should a landlord want to engage with full abatement, for example, that could cause temporary displacement, and that lead safe home, the housing body would come together to devise a plan on how to protect against that. I want to share a little bit about the policymaking process. Again, our incredible partners and enterprise community partners took on the role of facilitating the policy committee, which was, at my last check, it had 75 members, and on average, this group was meeting between January and May 1st when they announced publicly that they would have their policy recommendations submitted to Cleveland Counsel. They had a group of 75, and on average, 50 people were showing up to these bi-weekly meetings. And it really is an incredible showing of what happens when you find the right political moment, you have the right political narrative, and you're getting the right people in the room who care. They saw that there was light at the end of the tunnel, and they knew that their work and that their time and energy was going to be made useful. Not only did that group meet regularly and was facilitated very well, but there were also multiple subcommittees. So we had broken up the policy into 4 overarching areas: prevention with a focus on making homes lead safe, testing and screening, as I mentioned a little bit previously, outreach and education to the community, to landlords and to others, and interventions after children have been lead poisoned, if in fact they, hopefully this will prevent most of that, but we know that children will continue to be lead poisoned, and what are the interventions that we can take advantage of in those cases. So those 4 subcommittees were also meeting on a bi-weekly and sometimes more basis, and through this complex working relationship, ultimately the committee voted on 33 policy recommendations. None of them got less than 90% support. I think almost all of them, if not all of them, got 95% or more support for the recommendations that were then submitted to City Council in May. About 8 weeks later, in mid-June, City Council proposed the legislation and then passed it, actually, in July of 2019. This is the point where I want to talk about the Lead Safe Home Summit. I know I mentioned this previously, but this played a really important role in our long-term political strategy. Again, the last thing that we wanted to do with this coalition was convene people for the sake of convening, because nobody has time and nobody cares to do that, frankly. But the Lead Safe Home Summit we knew was a really important opportunity for bringing multiple folks together across perspectives and lived experiences to learn about lead poisoning, to learn about their role in addressing it, to co-create policy and to co-create ideas about how we can continue to move forward. We had an incredible keynote address from our colleagues over in Flint, Michigan. And importantly, we had been working really hard with our City Council colleagues to ensure that the legislation itself would be heard in this public forum and debated in a public forum. And luckily that day, the Health and Human Services Committee of City Council actually passed the legislation out of committee. They voted there, passed it out of committee unanimously. And in fact, there were only 2 co-sponsors of the policy originally. When there were 600 attendees at this summit, they got nearly every member of the Health and Human Services Committee, if not every member, to co-sponsor. So it went from 2 council members to something like 9 council members co-sponsoring a really important but controversial legislation, and that really set it up on a fast track for moving through the rest of City Council. And I have to say here, none of this would be possible were it not for our incredible partnerships with elected officials, particularly Councilman Blaine Griffin, who chairs the Health and Human Services Committee in Cleveland City Council, his colleague, of course, Carrie McCormack, who is vice chair of the Health and Human Services Committee, as well as Council President Kelly. None of this, as I said, would have been possible, but really this required courageous leadership, and it was the right people in the right place that helped make it all happen. Here's just a couple images from the Let's Safe Home Summit. We had amazing artists there that were also documenting as we went throughout the day. And this leads, of course, to our community engagement work that Kim facilitates.
Yeah, thank you. I think what's important about this process is centering people and not institutions. So with community engagement and really equity and equity value, we wanted to really think about what community engagement could look like and how it looks different. We throw that word around a lot, and we don't want to check the box process. So with community engagement, we really broke that down into 3 subcommittees. One was nonprofit and the faith community. The second was community development corporations. We have a broad infrastructure of community development corporations in every neighborhood, so they are really key to this, especially execution and getting the word out in the neighborhoods. And we also have a community action team that's made up of residents and resident leaders that do not associate with any particular organization or formalized organization or institution on purpose, because they are the true leaders in their communities and they work directly with residents. So we've engaged the community action team in a capacity building process, so they're really knowledgeable. They know who's responsible for what. They understand what this law could mean and how it might impact individuals in their communities. And so we meet regularly. We meet once a month with community engagement, and we really want to engage the community engagement team in the marketing messaging once we get to that point and think about this campaign and what it should look like. And so we have about 25 to 30 people show up every month that are from the multi-sectors, the city, other nonprofits, community development funders. They come and participate, and everyone is working together, residents as well as decision makers at the community engagement level. And we also have meetings in the evening in the neighborhood. So it's very important that the energy is there and we continue this process of centering people and not just the institutions related to this plan and execution. And everybody is working together in lockstep every month.
Can I just sing your praises for a moment, Kim? Because what Kim is doing a really great job of sharing an overview of the Community Engagement Committee. And it's really important to know that this would only be possible with a leader like him who's been in the community for 20 plus years doing this work. When we talk about community trust, we don't just mean something that we put in a grant report. Yeah. It really requires anger. Yeah. It requires fear. It requires tears sometimes. I mean, even in our recent steering committee, I'm not a steering committee member, but I staffed the steering committee, and Kim recently chaired. We have a kind of a rotating chair structure for the steering committee, and there are some concerns about whose voices are heard and how are decisions being made, and what does this process look like? And Kim just put it out on the table, like, look, there's really clearly some tension here. How is it that we work through it? Like, this is a moment to speak up and let's work through it. And it's uncomfortable, and it takes, again, courageous leadership. And that's really the crux of this type of community engagement, that it isn't just about you know, showing up on a Saturday and patting yourself on the back because, you know, because this is a convenient and politically sexy thing to be engaged with. It takes a good deal of emotional buy-in and spiritual work in order to make this happen.
Thank you. And so part of that also relationship building is that the folks from Building and Housing, City of Cleveland, even Dan or Enterprise come down on a Saturday to the neighborhood and meet with the action team members, because they must understand we can't talk at folks, we got to engage, and they got to understand how things are related, so when they work with people, they can really make a better impact in the community. Things have to look different than what they looked like before.
Well said.
Thank you. So we've engaged counsel, and we had a series of policy town halls before the policy was passed to try to get a pulse in the communities. We had about 5. It was a lot of work, right? So we worked with city council, and now the community action team members, working in partnership with the community engagement team, we centered the resident leaders on the Let's Say Living Now series. I have been supported by Joyce and National Centers, as well as the Midwest Environmental Justice Network, to kind of cultivate with the action team and capacity building, but this was an experiment for them to create this series. How would they like it to look? What would they want to say? How are we answering the questions that were presented at the town halls, bringing that feedback together and thinking about how we would then present as an initial kind of modeling. So we'll take the best of these series. We are working on East and West Side of Cleveland. We have to create a series that's Spanish only. Things like that that answer deal with the barriers and what people are facing within their communities. And we also had from the ground up, a power conversation around voting, precinct leadership, council membership, who's making decisions for your ward. So that's also integrating the conversation, because it's very important that people on the ground understand how to make real change and how decisions are made. And so we really need to integrate this idea around power, control, and equity for real. And this is part of the capacity building and integrated in our series and conversations.
So I'm going to loop back now to a little bit of the policy conversation and connect it here to the Resource Development Committee chaired by the George Gunn Foundation. Originally, the Resource Development Committee had the scope of identifying both the community need for making policy and systems change, as well as what resources are currently available and what resources would need to be available in order to breathe life into the type of vision that we have for the city of Cleveland being led safe in 10 years. The second piece was modeling and capitalizing what we now call the Lead Safe Home Fund. And as you'll see on your screen, the idea behind the fund is to help finance improvements in our community's housing stock and to provide support services for children and families and all others who are touched by this Lead Safe certificate system. I want to say before I dive into some of the details of the Lead Safe Home Fund that it was largely informed by our incredible partnership with the Case Western Reserve University Poverty Center. We had originally engaged in a partnership with the Poverty Center, in early 2018. They've long been reporting on all issues related to children and families and housing conditions and a whole host of other issues related to community development. They had recently written quite a bit about lead poisoning prevention, and we realized early on that in order to do this work well, we had to be particularly sensitive, not just to the community at large, but also to those who would be responsible for carrying out the mandates of a lead ordinance should we ultimately make it to that place. We had some idea that policy and systems change would likely be necessary in order for us to make a dent in the lead poisoning crisis, but in order to get there, we needed to really make sure that we were checking our underlying assumptions about who was involved. That said, Case did the most incredible research that we've ever had in this community around the profile of all rental units in the city of Cleveland. And we're talking about how many units there are, where they're located, their history, their tax delinquency, their housing quality, whether or not they've had a lead violation or any other housing violation, their external appearance, other issues, but basically a full-scale profile of all rental units in the city of Cleveland, the likes of which we literally have never had before. We hadn't yet up until this point had any system of proactive rental inspection. We also don't have a point of sale inspection in the city of Cleveland. So our knowledge about the housing conditions here was relatively limited until this research. The research also included a profile of every Cleveland landlord. So we have a deep sense of how many landlords there are, the number of LLCs, the number of major companies, where they're located, where they live, where they're paying taxes. So we have the clearest picture that we've ever had about both the nature of the housing stock as well as those who own the housing stock. And what that research told us very clearly was that the majority, a great majority of Cleveland's landlords actually live in the city of Cleveland. When we initially, I'll just share my own, I don't want to speak for the coalition when I say this, I'll speak for my own biases when I say, you know, I had assumed coming into this that this was really an issue of power imbalance and that there were a bunch of cigar smoking landlords living out in California making money off of the lives of children here in Cleveland. But actually what the data tell us is that many landlords, most landlords, are what we would consider kind of mom and pop operators, that they themselves own maybe 1 or 2 properties, that in many cases, if they own a double, a duplex, they often live on one side of the building and rent out the other. So they are, in the vast majority of cases, living in the same housing conditions that they are renting out. The nature of Cleveland's landlords is very similar to the nature of Cleveland writ large. And for us, that really gave us pause to understand, and it required that we understand what resources would need to be available in order to breathe life into the policy and systems change that we were hoping to effectuate. That led to this creation, as I mentioned, of the Lead Safe Home Fund, which is an overarching title for basically 2 pillars. The first pillar, which I'll provide just a little bit of information on, but actually I'll dive into the second pillar in more detail. The first pillar is the Lead Safe Resource Center, and you can see a couple bullets on your screen here. That includes sort of the central operating hub of the entire Lead Safe certificate system. It includes outreach and education, resource navigation, including a 24-hour hotline. It will include other services, kind of system navigation services for residents and for property owners, as well as the centralized hub for workforce development. And if we have time toward the end, Kim is going to talk a little bit more about workforce development. Suffice it to say at this moment that we don't yet have a sufficient workforce in order to manage the impending workload that the Lead Safe certificate system is going to require. The second pillar of the Lead Safe Home Fund is the home loans and grants. And the home loans and grants are a suite of financial mechanisms that we expect to make available to property owners across the city to assist them with complying with the Lead Safe certificate system. So you can see here is just a 10,000-foot budget. Certainly there are much more detailed budgets, and if you check out the Mount Sinai Foundation website under our little health policy tab, scroll down to the lead poisoning section, and there's actually a link to our investor package. In fact, we're happy to share that with Anna, and perhaps she can distribute that out. But suffice it to say, we are looking to capitalize basically 5 levels of financial product that we hope to make available to property owners, and those are listed on the second half of the screen. First, we have a significant amount of resource available for Lead Safe certificate incentives. What we know is that the process, even the process of getting a clearance examination, which can cost $250-ish in the Cleveland market, or a lead risk assessment, which can cost $400, $450, $500 in the Cleveland market, even that process of knowing the status of a property can be prohibitive to landlords engaging with the certificate system. So that's an opportunity for landlords to get a foot in the door into the system, to have a warm handshake, a friendly face, and to really offset the cost of even the lowest level of knowledge and awareness about the safety of a property. The second and the most significant line item you see here are interim, what we're calling interim control grants. These are just home repair grants. It's likely that these will be framed as something like forgivable loans. Of course, we budget those as grants, but those are small level grants for landlords to do the home repairs that are necessary in order for their properties to result in the passage of a clearance examination. Meaning, if you need $1,000 to repaint your rental unit in order to bring it up to a Lead Safe standard, and if you are eligible, and it's likely that there will be income eligibility requirements, something along those lines, we're still working those through. But if you need resource in order to make your home Lead Safe, we want to make sure that that resource is available, because we know that many landlords in Cleveland simply don't have the assets to make it happen. And then the following 3 lines that you see there on the screen are 3 different loan products. The first, of course, is guarantee and first loss capital, which we expect to be kind of 0% loan. The second, mission-driven capital from mission-driven organizations, what we would call PRI or project-related investments on the philanthropy side. Those would be 1 or 2, maybe 3% loans. And then, of course, finally, bank and other more traditional capital that we know some landlords should be qualifying for, could be qualifying for, but either don't access them or can't access them. We want to make sure that all these levels of capital and perhaps even blended products will be made available for landlords and property owners of all need levels. And again, you know, I think it's really important here, not to get overly philosophical, but recall that early map that we showed about lead poisoning prevention, or rather lead poisoning rates and redlining. Ultimately, this is in some ways an issue of racism. In many ways, this is an issue about racism and unjust systems. It's also at another level an issue of disinvestment, historical disinvestment in community. What the Lead Safe Home Fund does is create a system and a structure and a new investment mechanism that, as far as we can tell, has never before existed to reinvest in rental properties and in community maintenance and repair. You know, frankly, these financial products haven't before existed. We're really talking about grants and loans, home repair loans rather, to landlords, to small business operators. That type of product, as far as we can tell, hasn't before existed. And that, to me, is one of the most exciting things about the system that we're building out. I'll stop rambling here just to say that we're really excited to announce that we've gotten, in our earliest level investments, we've gotten now more than $10 million in grant funds for this full $99.4 million budget that we're building out over the next 5 years. The last thing that I'll say, I see that we're running a little bit up on time, so let me just skim through the Research and Evaluation Committee. Again, this is facilitated by our colleagues at Case Western Reserve University, but they've really been charged with creating baseline metrics and measuring changes in both systems and policies, as well as childhood lead poisoning rates over the next several years. They'll also serve as a clearinghouse for all relevant data and a public-facing dashboard. And they'll support the Lead Safe Advisory Board, which I had mentioned previously was mandated in the new law, as well as assist with public reporting on the progress. So this is an external evaluator serving in an external evaluation capacity to make sure that the policy and systems that we're working to implement actually do what they're intended to do. And this is just a sample. This is an early draft version of some of the metrics that we're looking at. So you'll see there are metrics at the housing levels, at the landlord levels, really at the policy and systems level, and then more digging down at the deeper level of individual children, individual tenants, and renters, and others. So I'd be remiss to say that if I said that we had it all wrapped up, that everything was fine and dandy. I'm looking over at Kim and she's smiling, she's cracking up. We've got a lot left to do. I don't know if you want to say a word on workforce development.
No, I think that the fact that we have to create this efficient system and a system that creates access points as well for neighborhoods. So I think what's important here is to note that what's going to be look different. We know people need to work, but also thinking about entrepreneurship. How can we take folks from entering our system, pipeline them, to also think about entrepreneurship if they so choose? So thinking broader than just transactions and getting the work done, but how are we actually building capacity in neighborhoods so people can work where they live potentially through this system as a real access point. So I would love to evaluate that over a year or two.
Yeah, and what's important about the workforce development pieces on the resource center side is that, you know, it may very well be the case, we're actually researching now how many inspectors and contractors currently exist, and it may be the case that we actually do have enough contractors and inspectors. One of the really important pieces to all of this coming together is cultural competence, and the ability of an inspector or a contractor to go into a home in a neighborhood where they otherwise might not be going because the resource hasn't been there historically. That can be a real barrier to the system actually working. And so the opportunity here to be recruiting folks in a non-institutional way, recruiting folks from neighborhood, maybe even those who have been affected by lead poisoning, to enter this type of workforce. And we're talking about jobs that will be continually available. One thing I didn't mention about the policy is that it's not rolled out on an annual basis. It's actually rolled out on a quarterly basis based on quadrants of the city. So 1/8 of the city over a 2-year period is required to comply with the mandate every quarter. So we won't have landlords that wait until the end of the year to get their lead safe certificate and then turn them all in. We actually have every quarter a new workflow and a new series of jobs that need to be completed. And so we expect that this workforce will actually be pretty stable relative to other similar initiatives. I don't need to talk anymore about the ordinance. We've already dug in there. I will just say that there are a few other policy challenges that we're working on actively. Of course, we're working on support for the lead safe certificate system and building the systems and the processes to ensure that it can be implemented. It starts, I should say, March 2021. That was one thing that we advocated for strongly, was an 18-month ramp-up period so we can create all of this infrastructure between the time when the legislation was passed and when it would be implemented. Of course, we're looking to implement the Lead Safe Home Fund and launch the Resource Center likely in the first quarter of 2020. We have a subcommittee now actively working on early childhood screening and testing rates, and I won't be able to dig into our many incredible partnerships with the state and federal governments at this juncture, but we have had some really early successes in working with the Ohio Department of Medicaid and ensuring that healthcare payers are held accountable for those lead testing and screening rates. And then finally, we're also looking at lead safe standards in childcare facilities. Of course, there's a long list of complicated systems that interact with childcare facilities that are very distinct from the housing code, and it looks like most of those are facilitated at the state level. And so we're, again, working with our state partners to ensure that through the Department of Jobs and Family Services and Department of Education and through accreditation that we're providing the structure as well as the resources that are necessary to protect children wherever they are, whether that's at home or in childcare. So we got in just in time. We have a few questions, Anna. I'm sorry to have gone over here.
No, thank you so much. Thank you both so much for a wonderful presentation. Yeah, so to our attendees, some of you guys have been submitting your questions, but if you haven't yet, I encourage you to do so so we can get it done as we are live. But our first question is, of the 33 policy recommendations, how many were included in the legislation? This was, I believe, Dan, when you were talking about the lead safe renewals and the proactive rental inspection.
So I don't have a specific number for you. I can share with you that the vast majority of our recommendations were included in the policy. We had a few that didn't make it and a few that, of course, we knew were long shots. And I'll just give you a little background on political strategy. Of course, there were some that we knew were long stretches, and there were some that we knew we would not back down from. And I can say that not only were all the things that we really, really felt strongly about included in the legislation, but also even some of our, man, if we could wave a magic wand, policies were also included. So overall, we're incredibly happy with the strength of the legislation and its enforcement mechanisms. I don't have a specific number, but by and large, it was really reflective of the coalition's desires.
Great. And then we have a question from our friends over in Buffalo. They asked, can we get a copy of this rental unit research? It would be a great model for similar research in Buffalo, New York. I don't know if you can share that with me, and then I can disseminate it out to our listeners if that's possible.
I don't see why not. I mean, there's nothing secret about the coalition, so I presume so. Let me check with our colleagues over at Case Western Reserve. I don't want to over speak for them, but I can't imagine why we wouldn't. In fact, in our investor package, we have a lot of the underlying assumptions about the research we did with landlords. And we know, by the way, that Buffalo is doing incredible work around user-centered design with landlords, and that's been incredibly helpful for our work too. So hi to Buffalo, thanks for doing all your incredible work, and we'll be sure to share out what we're able.
Great, thanks. So yeah, if that is available, I will be able to share that via email, a follow-up email to all of our listeners. So look out for that in the future. I have a few more questions here. We have a couple more minutes, so I'll just keep rattling these off. Are the biannual inspections only for lead hazards?
Yeah, I'm a risk assessor, and so I contributed a lot of a conversation about what does it mean to have a risk assessment? What's the importance of having a lead clearance technician do the work versus a risk assessor do the work, right? So it's important to understand, according to Ohio law and the maintenance standard and guiding principles around maintenance, we wanted to do the 2-year because I think it was a happy medium between what's required for risk assessors and also giving landlords the opportunity to do what they need to do within a 2-year time frame.
I'll just add to that, and then I want to add one more perspective. So HUD regulations also recommend that for the application of interim controls that they be maintained on a 2-year basis. The law doesn't actually require the application of interim controls. What it does require is that landlords pass the clearance examination. We presume that most landlords will apply interim controls in order to make that happen. So that's really where the 2-year requirement comes in. If landlords do a lead risk assessment and employ full abatement, then they can get a, quote, lead-free status, which lasts for 20 years. There was another piece of that question that I wanted to hit on, but I'm forgetting it, so I apologize.
Great, thank you. Yeah, and Dan, it sounded like you were sort of headed on the same track, but I have a question here that says, what happens when a property fails a clearance test?
Yeah, so we're happy to forward you the ordinance. I also don't want to overspeak for the city and its enforcement mechanisms, but the penalties range from civil all the way up until criminal. And so it would be basically a citation followed by a ticket, followed by, whatever comes after that. We advocated really strongly for robust enforcement, but also with resources made available to landlords. So if a property fails, technically it's a violation, and for that landlord to continue to be renting that property without getting the certificate.
Okay, great. And then this is sort of regarding community engagement. How many individuals attended your community classes? I don't know if, Kim, you have that number off the top of your head.
Yeah. Well, I've had policy and advocacy classes for the community action team members, and I've had 2 rounds, and we have probably about 16 folks and a lot of these members have been working with me over a year. So I started the winter prior to the coalition launching, so they've engaged with me for a while. And then we have another cohort of policy and advocacy classes coming up in January. And then that will be it. And then we'll continue to cultivate the team culture that we started. So in all, I would say I probably have about 20, 25 residents who have been actively engaged throughout the process. And they will then create a model and a plan to engage more folks. So we just want to build a core and then continue to work from that.
Great. So we have a couple minutes left. I'll just rattle off a few more, and then if we don't get to them, the rest I can get these out to the presenters and we can get answers out. But here's one. How have you communicated to tenants that clearance inspections will take place? We understand that there is a major barrier to these inspections if the tenant is reluctant to allow entry.
So one intentional, we have a resident leader that actually worked with the Cleveland Tenants Organization. And so we are building that understanding at the grassroots level, but we are engaged with thinking through a contract with someone to help us with marketing and education and awareness. So that's to come. And like Dan said earlier, we've been developing this thing, right? So we're still working on some aspects, and communication messaging was a gap, but now we have to fill that and get out there and have more conversations. Now that we're a little more solid and know what we're saying, what we're doing, how we want it to look, we can start to deliver the right messaging out in the community.
Yeah, I'll just add on to that, in addition to retaining now a communications firm that's going to manage our, will assist with the communications both to landlords and tenants and to the broader public, they're tasked with working directly with the community engagement and the resident action leaders to get that message out. And really it's the community engagement committee and the resident action teams that are going to be shaping what the message is and how it goes out. That's one piece. The second piece is that although we know that most landlords are mom and pop shops, we also know that there are absentee landlords, and there are landlords that will not want to comply, and frankly, they wouldn't comply with any policy. So we will have to rely on deep relationship with tenants, because if the landlord doesn't want to allow access, then we have to rely on the relationship with the tenants in order to allow access. Part of the law that I didn't mention but is extremely important is a slew of tenant protections that are associated with this law. So there are protections against tenant retaliation. There are increased protections for and increased disclosures required for both property owners, for owner-occupied in the sale of units, as well as landlords to tenants. And this is all happening at the same time as really important work around right to counsel. So Cleveland just passed a right to counsel in cases of eviction for all families at or below 100% of the federal poverty line. Private philanthropy is partnering with our legal aid partners to expand that to hopefully 200% of the federal poverty line. But part of that work also includes countersuits and preparing for countersuits to prevent against eviction by using housing conditions, housing quality complaints in order to protect families and maintain stable housing, while also ensuring that we have access to housing and can make sure that it's safe for families. As I said,
great. Well, thank you guys.
It's so much more complicated than we could possibly articulate in a 40-minute. We appreciate your grace.
Great. Well, thank you both for your thoughtful answers. It looks like we're coming up on time, so I'll wrap this up. I just want to thank our friends over at Regional Asthma Management and Prevention for helping to coordinate. And also just a huge thank you again to our panelists, Dan, Cohn, and Kim Foreman. Thank you so much for taking your time today and for all the amazing work that you're doing in Cleveland. Again, just to our attendees, the slide deck and recording of the webinar will be available online. You'll receive a follow-up email with links to the materials that we just discussed in the Q&A if they become available, and also the recording and slide deck. So again, thanks to everybody for joining. Thanks to our panelists, and this concludes our webinar. Have a great rest of your day.
Great, thanks you too.